Hi, I'm Dr. Michael Lynn Gurney. Thanks for joining me as I discuss how we treated this patient with ectodermal dysplasia. This disorder, as you can see here from the National Foundation of Ectodermal Dysplasia, is not that common, but it affects the hair, nails, teeth, skin, and glands. You can see there's a characteristic appearance of how it affects the teeth and facial features. There are more than 50 different types of ectodermal dysplasia. In my training at Ohio State, we were a treatment center for this disorder, and we would treat quite a few of them. So I enjoy doing it. It's a wonderful experience when it's all done and complete, and it really changes people's lives. This is an example of one of those patients I treated in my residency. She presented with some of the classic signs, where in this case, no teeth developed in the mandible and only six maxillary teeth. She came to the clinic at the time with crowns placed on those anterior four teeth. Those teeth are also pointed, just a classic sign of ectodermal dysplasia. Not everyone presents that way, but in this case, she did. I'm going to share an experience here in Boise in which I was referred a patient by Dr. Brian Ward, an orthodontist in Twin Falls, Idaho. He was mid-treatment with a young lady that had ectodermal dysplasia, not to the same presentation as, say, the classic signs of sparse, thin hair and different facial features and malformed teeth, but she did have congenitally missing teeth and somewhat peg-shaped teeth as well. You'll see that in just a second. He referred her as he was beginning to come close to the end of her orthodontic treatment, and he wanted to know or get some guidance or some help on fine-tuning the orthodontics as well as what options might be available for her to restore the missing teeth. So this is our patient. She's 17 at the time. You can see she's currently in braces. I love taking this lip reposed position. It helps me identify if the teeth are in the right position or not. And then we have them smile and see how great the lip movement is. And as you can see here, she's missing quite a few teeth and has some retained baby teeth. Here you get a better idea of which teeth are the deciduous teeth. So once I gather all that data and we look at aesthetics and we look at the occlusion, we look at which teeth are present, we look at the health of the mouth, we try to do a smile design in that process to help me visualize better where we may head with this case. As you can see here, I then mark the interpupillary line, which helps us give a reference of the anterior occlusal plane and the mid-face to see where the midline relates to the teeth. We blow that up to get a better view of it, and then we retract the cheeks and start outlining where the teeth are at this point in time. You'll see here, ideally, we'd move the teeth a little bit more, especially those centrals, to have the midline of the teeth be coincident with the midline of the face. Like I said, I love doing a smile design because it helps me start to just visualize where we need to go. You can see here how we change the position of the teeth would be more ideal. Then from there, we can design what do we want the teeth to look like. You can see here to have more ideal proportions in our tooth. Ideally 80% as wide as they are tall. There's going to be a high probability there's too much gingiva to obtain the result we want. We thought the incisal edge position was at a decent position. So you'll see we didn't lengthen the incisal edge position of tooth 9, but we did on 8. You'll see also reshaping the teeth in 11 and 6. Also in the mandible, those teeth are small and they would need to be enlarged as well to better provide the occlusion and proportions of the teeth. This is one of my favorite diagrams in a 2D smile design. As you can see, what the tooth shape is now in the dotted line, and the solid line being what we'd like it to be. Helps me then say, how do we get there? How do we get from point A to point B? And it allows me to then map out her course of treatment. Also in this, you can see, hey, let's need to replace some missing teeth here. In that process, then we can identify, okay, can we do dental implants? So at this point, we have a pretty good idea of what we think we would like to do. We know all the diagnoses, and I go in and put together a pretty detailed analysis of that. I go in and write all my diagnostic findings, provide the pictures and radiographs, and then we go in and make the treatment plan. In this case, as you can tell from that previous picture or image, there is going to need to be a little bit more orthodontic movement. There needs to be some dental implants utilized to help replace the missing teeth. Via CT scan, one can see that there's not enough bone at the present time to place those implants. She would require width bone augmentation to allow us to place those implants successfully. So I write that all up. In the blue table, that's where the treatment plan is described. Below it is a treatment sequence. In this case, we would need Dr. Ward to help us do some more tooth movement. She would need to meet with an oral surgeon to properly graft these edentulous sites in preparation for the dental implants, and then she'd go back to the surgeon at the appropriate time to place the implants. This can be done in a sequence that maximizes the time available, meaning while she's in ortho, she can do some of the grafting, and likely close to the end of ortho, she can perform or have performed the dental implant placement. This is all mapped out clearly in that treatment sequence in that kind of teal blue section below the blue table. In that as well below it, there is a risk analysis of what the risks might be, and then the patient can agree or accept this treatment summary. This letter to me is one of the most important aspects of doing a diagnostic workup. From here, I took this data and formulated two letters, one back to Dr. Brian Ward, explaining the things that I would like to do to accomplish her treatment, and a letter of referral to Dr. Tim Hopkins, who is also in Twin Falls and works a lot with Dr. Brian Ward. He would then see the data that we've gathered. I would send him the CT scan, the digital impressions, my smile design, all the data in this letter, and any other radiographs that we obtained that we could then collaborate more effectively. So these letters were sent. My team then got on the phone and collaborated with these doctors and helped make sure this patient was returned back to their offices to perform the necessary evaluation to supplement our plan. At that time, the patient was excited to move forward. Her parents, who were separated, so both her parents and her step parents agreed that this would be a good plan for her, and we started moving forward with the plan. I believe she had the grafting done and the orthodontic tooth movement done. We tried to keep in touch with her through orthodontic progress evaluations. Depending on the situation, it can be either monthly or every quarter or every 6 months, depending on how well we work with the orthodontist and how well they communicate. In this case, we tried to see this patient every 4 months or so. We did pretty good at that. This is one of those orthodontic evaluation appointments. You can see now that some of the deciduous teeth were removed, and the orthodontics is progressing quite well. Then there's a period of time that we didn't see this patient for a while. She kind of, quote unquote, disappeared. As we worked with Dr. Brian Ward, we found out that there were some family circumstances that ultimately made this completion of this treatment more difficult, and the finances needed to complete it weren't there. And in some ways, the parents just told her, from our understanding, was that, hey, you're getting to be an adult now, you need to take care of this. which means she couldn't afford much on her own. Dr. Brian Ward was phenomenal. He talked with her and he just felt so bad that she'd been through so much work that she couldn't finish her treatment. He called me and said, "Hey, is there any way that I can pay for her treatment?" Of course, he could if he really, really wanted to, but I talked with my partners and my team, and we discussed it in our lab, and we decided that if he was willing to pay for her treatment to have it completed, to see it through, that we would find a way to help complete her treatment, that he wouldn't have to do that. So we brought her back in. The braces were off at this time. This is what he could accomplish. So we came up with a new game plan. It meant, things had to change. She couldn't afford uh, the rest of the surgery and the prosthetics. We tried to evaluate it and say, what else could we do? So we basically did a new evaluation and came up with a new game plan. And I presented it to her just as if it was new, like when we first met her a couple of years previous. In this game plan, we decided that we wouldn't use dental implants at this time. Her teeth were positioned well enough that we could use um, a ceramic bridge on the missing teeth areas, which would include, the posterior right and the posterior left maxilla and mandible, and then crowns on the anterior teeth. The gingiva looked much better than it did previously while she was in orthodontics, so we thought that maybe just some minimal aesthetic crown lengthening would be sufficient. We presented this plan to her, and she said, "Hey, let's move forward with this." Of course, she was willing and able because it didn't cost her as much money to do this, but she was super excited. So we moved forward with the game plan. I always map it out step by step so we know, my team knows, and also the patient knows, what's involved in this process. We're pretty fortunate here because we have a full service in-house lab that has all milling capacity that you could think of. We have ExoCAD to help design restorations, and we have a digital technology of an intraoral scanner, the Trios 4, to help us. Now, this made it possible that we could bring her in and provide her a great prototype phase. I love making prototypes. It's probably one of the most important things and essential things I think we can do. What does this mean? We brought her in and we prepped all of her teeth. We made the records appropriate to take that digital data into the lab and then design prototype crowns. Our lab would then mill those prototype crowns and deliver them the same day. I'll walk you through that process here. And so here it is outlined again, preparation and records, or pre-preparation and records, and then we would prepare teeth and get those in preparation records, meaning as we're in that appointment, we would get the records to send to the lab. We would design the prototypes, fabricate the prototypes, and insert them. Just a note on prototypes. I've learned that I do not ever skip a prototype phase anymore. And you notice I say prototype and not temporary or provisional. Prototypes are valuable. They help us understand the occlusion, the phonetics, the aesthetics. We help dial in little quirks and details patients might get stuck on before we move on to the final restorations. They also provide a really stable, predictable, and aesthetic result that can transition the patient into their finals much, much more effectively and allow them to be more stable so they can go about their normal daily routine much more effectively as well. We also gain the records we need to make the finals to make them more precise and detailed. So I'll walk you through the process again. So we always obtain this record, especially in her case where we needed to open her vertical dimension. We calculated that, made a leaf gauge record with the posterior teeth, and we then made a smile picture with her teeth together. And in this case, it's on the bite record. This helps us correlate all this data, the photos, the digital impressions, the prep teeth impressions, all into the software correctly. And so we always start with this one. It's always a smile photo with parallel to the floor, looking straight at her with symmetry on both sides of her face and her forehead and chin, and smiling as big as she can. You'll see later why this is a critical point of our appointment. We then go through and prep all the teeth. In this case, we prep it sequentially so we can obtain those records we used previously to retain that occlusal relationship of vertical dimension as we go through this process. I didn't take those pictures during this step. Ultimately, you have to trust me that that vertical dimension, those records we obtained, for example, we'd prep the left side, then make it a record of the prep teeth with the right pre-bite registration in place. Then we would prep the right side, for example, use the new left side prep to prep bite record, and then make one on the right side. In the end, we were able to take those records and come in and design a set of prototype crowns. This is a video that I obtained. I actually made these records and made the prototype crowns. So we programmed exocad to do what we wanted to do. Ultimately, exocad is capable of doing almost anything, especially if you understand what this initial programming stage requires. Once it's set and programmed, then we'll bring in the digital files needed to complete the case. I skipped through the bringing in of the digital files so you don't see any names of patients. So the next step, you'll see just the files or the data inside exocad. And there you go. There's the mandibular impression that we obtained with the trios. We're setting the insertion angle, and we've already obtained the bite record. It's in that direct or exact orientation. We're now bringing in the maxillary preoperative scan so that we can correlate it and use it as a reference when we use the Smile Creator or virtual try-in portion of the software. And so once that's done, see here, we can now correlate the teeth with the picture. This is one of my favorite things about any digital software these days is instead of, you saw initially that 2D smile design, we can do a 3D smile design and ultimately have a virtual try-in of that setup. So I feel like we're pretty close there. At that point, we remove this part of the picture or cut it from the 2D image so we can have a window from which the posterior or the three-dimensional teeth or 3D teeth can be viewed. So there you go. From there, we will go through and design the teeth based on the parameters. You'll notice here that ultimately orthodontics didn't quite get us exactly where we needed. I think that's due to some of the anchorage limitations that we had. We were planning on using the implants to help us finish the movement, but we couldn't. So here we mark all the margins. In this case, because they're prototypes, I feel they don't have to be quite as exact as the finals. In the finals, I won't show you videos of how they made the finals, but we'll take still PBS impressions from which they can take the dyes obtained from those impressions and merge them into the software. Here we're getting pretty close. Every prototype restoration I've had milled or designed and made always fits better than the chairside ones we used to make. So here we bring in the tooth mold that we like, and we just start aligning the teeth to where we think they need to be. It's a pretty quick process. I think in the end, this process took about 35 minutes. We condensed it down in this video to about 6. But you'll see how we can just move the teeth around, start placing them where they'd like to go. And each time I need to, I then do a virtual try-in or evaluation. Once we get them where we want, then we'll morph them to the tooth preps. And in this case, I wanted to open the vertical a little bit more. So I articulated the models into a virtual articulator so that I create a little more space for the restorations that we needed. Continue to finish the design. It is so much fun to do this. I'm not going to lie. I think it's like my video game. Played video games when I was younger. This is now my new video game. It's just kind of relaxing and fun to do. And you get to see it real time. It's just phenomenal. So much better than the way we used to do it in my residency where we would have to wax it up and then press crowns. And now we can design it and we can mill it. We're getting pretty close to being done here. I'm going to speed this up a little bit. And we get to the point where we're just fine tuning. This is like waxing the teeth. Just fine tuning the shape, form, contacts, thicknesses, occlusion. You'll see those little blue and green dots are the occlusion. So we're maximizing that. And ultimately we get to the point that we feel like, hey, we got a good design to use the prototype. Here we're using connectors to solidify the pontics. And at this point, you'll see we have some restorations ready to mill. When we feel like we're there, if I can keep them all in one piece, sometimes I'll do that. Sometimes I'll save them separately as different units so that we can mill them in different units. If I was to export it at this point, it would be one. But I think in this case, we went ahead and made, 3 different restorations so that we could have the machine mill a little more efficiently as well. We're trying to get this done in one day and be ready for her to wear them home. So at this point, these restorations are saved. And sorry, hang on just a second. So those restorations were saved, put into the milling unit, and milled. The mill takes about, when you have a full arch, upper and lower, about 2 hours or so to mill them. There's minimal finish to them. We have to polish them, maybe define a couple of the embrasures a little bit. Then we bring them in to deliver. And this is just an example of what happened the day that we delivered them. So you can see she's pretty happy. She'd seen nothing like this her whole life. And in one day, we're able to provide her something that was really, really pretty. And you'll see here that these are the prototypes that were milled that day and inserted. Obviously, there's things that can be worked out, and that's again the value of these prototypes is making something that's really close and nice. We can dial in the occlusion. We can take detailed notes of the aesthetics, shapes, contours, and really dial in what she would really like in the end. She wore this for a month or so. In the process, we would see her evaluate all those things, take good notes, and then we're ready for the final impressions. This day is super important as well. We take detailed notes of what things she'd like changed. If there were more significant changes, then we would usually mill a new prototype with the reflection of those changes in them and have her wear them for another period of time. But all in all, she's pretty happy, which she required. She was depending on us as well to make sure that we made the appropriate changes because she thought they were so nice compared to her original shape of teeth that she would have probably accepted anything. So we're very diligent in that way, just to almost probably too particular at times because we want to make sure they're happy and that we're happy with it. And our lab technician is also very particular. He doesn't want to see in the end something that looks, not like it could. He wants to provide the best thing he can. So when he looks at the restorations, he feels satisfaction as well. So here's the steps for the final impression. It's a pre-preparation impression, which means we're going to record that prototype design, how it looks and how it articulates together. We'll also take a lot of images of those so we can utilize those in the design process for the finals. Then we'll make final preparations of the teeth and final preparation records, which is packing cord and using PVS impressions. Then when it's all done, when all the records are obtained, then we reinsert the prototype restorations and they go home. So I'll try to walk you through this. I don't have pictures of the PVS impressions, but here's the pictures we take before we start the appointment. Before her lips are numb, before anything's happened, we take really good photos of her again, parallel to the floor, her eyes parallel, symmetry to her face, no rotation, right or left, no tilt of the head, up or down, and she's smiling with her teeth together as big as she can. Now, a lot of people don't smile with their teeth together. But that's okay. For what we need them to do that. It helps us in the lab. Here we can see at rest how much teeth are visible. That helps us know if the vertical dimension's correct or if the teeth are too long or too big. Here's again the smile with the teeth together. Also, this is one of the most important pictures you can take. This is with their chin down, and you're taking a big smile picture from above the nose. It helps you see if you have the right curvature and support of the lip. I can't express enough how important this picture is. It can be very deceiving if you look at something straight on, if and you can't always catch to see if there's symmetry in how it supports the lip or the curvature of the restorations. And then we always take this one from the side to see if the proclination or inclination is appropriate. Here is a bite record before we start. This helps us align the bite records throughout this process. I think it's super important to obtain this. Then you'll see we get a Facebook of the prototypes. Now at this point in the lab, they can print the models of the prototypes that we did with the trios. They can mount it just as we have it, so we have a starting point, a foundation for everything forward in the lab. Here we then remove the upper right side. At this point, we would usually pack cord, make any refinements to the teeth, and then obtain a bite record using the occlusion of the existing provisionals. Then we'll do the same thing to the left side. We would remove the provisionals, insert the cords, usually one cord at this point, and utilize the bite record from the prep side on the right with the opposing prototypes and make the same record on the left. These records now, when we get a final impression of the maxillary prep teeth, we can then go to those mounted models of the provisionals and mount the maxilla opposing the lower provisionals. It gives you some great references as you start to design the new restorations. At this point, we would then move forward with the second cord and make our final impression of the maxilla, which again, I don't have a picture of that. But then after that impression, we would remove the lower right, insert the first cord, we do refinement of the preparation of the teeth, and make our bite records using, again, the records we previously obtained. Then we do the same thing with the left. Once it's done, then we pack our second cord and allow us to make our final PVS impression of the mandible. At that point, we have everything prepared, ideally as we can, paying close attention to the gingival margins, making sure they're even facially, but also interproximally, so our lab can make the nicest emergence profile of teeth possible. At that point, we would also scan these records in with the trios, give them just more data as we can. We take imagery of the teeth and the shades of the teeth, so the lab will know what the stump shades are to help make sure everything is designed appropriately. From there, we take this data into exocad, and you can see that the lab then designed a new set of teeth with all the changes we needed. They, in the software, cut it back. These crowns will be zirconia crowns with veneered porcelain on them. Once they're all done, our lab technician always tries to make beautiful images or photos of his work. And you can see the contours, the surface texture are just phenomenal, especially for zirconia crowns. Same thing here in the mandible. Once they're all ready, we bring the patient back and we try them in. This process is pretty detailed as well. We'll usually remove the prototype restorations. We'll try in each restoration one by one to make sure they fit appropriately, that the margins are sealed. Then we'll try them in side by side and check the contacts. I don't have images of all these, but I'll just explain that. As we try them in side by side, we will use shim stock to verify the contact between the teeth. If it tears the shim stock while it's held in there, the contacts are too tight. It's not seating all the way when the contacts are too tight. So we make adjustments to them until they lightly drag that shim stock without tearing it. And then we have the patient approve them. If they approve the restorations and the fit is good and the occlusion is good, then we will cement the restorations and make final adjustments. So this is us working at it with this patient. This is my wonderful assistant, Lisa. She's pretty amazing. Doing these cases with someone that's highly trained and skilled really makes a huge difference, especially for the patient. They can feel the confidence and trust. They know that they're in good hands, and the appointments always go better. In the end, this is the final results that we obtained with our patient. She was super excited about these restorations, and as you can tell, changed her life. That's probably my favorite thing about what we get to do on these types of cases is build a relationship with someone that, in the end, in the beginning, didn't have much hope of anything good. especially in her situation where everything kind of shut down too. You know, she came in, we had this excitement for, you know, fixing her situation. She had all these aspirations for school and continuing her life, and this was, you know, ultimately going to help her get there, and then it all got shut down. And you can just see that hope and despair come, hope leave and despair come back. But you can see in her face, and you just notice how much more happy she is in her eyes. To be involved in that is one of the greatest things I've ever been able to do. Um, I hope you guys have the same opportunity to help someone in that way and change their life in such a positive way. Um, Thank you for your time. And if you have questions, feel free to reach out to any of us at Boise Prosthodontics at any time. We'll be more than happy to help you. And until next time.